We begin with the pandemic. The World Health Organization reports there are nearly 15 million deaths globally associated with COVID-19.
That's right. The deaths were either directly from COVID or attributed to the pandemic's impact on healthcare systems and society. This comes as the U.S. closes in on a sobering benchmark of its own 1 million COVID deaths. Meanwhile, cases are rising in the U.S., averaging over 57,000 per day. The CDC is attributing around 36% of all new infections to a new Omicron subvariant, BA.2.12.1. So joining us now to discuss this is Dr. Celine Gounder. She's an infectious disease specialist and epidemiologist at NYU and Bellevue. She's also the editor-at-large for public health at Kaiser Health News. Dr. Gounder, welcome. It's really great to have you with us. So the CDC is estimating that this new subvariant also accounts for nearly 62% of cases here in New York, which, as we know, was the epicenter of the virus back in March of 2020 when we all left the broadcast center here on 57th Street. So what do we know about this subvariant and its severity?
So this new ultra-infectious subvariant did emerge here in central New York State. We are seeing it spread throughout the Northeast. That's not surprising because of travel patterns. You have dense urban environments here in the Northeast, and it is spreading rapidly. We've seen a twofold increase in cases of COVID across the country in the past month. That's in part due to this new ultra-contagious subvariant, but also because people are returning to pre-pandemic life. If they hadn't already, many Americans have stopped wearing a mask. They're socializing indoors and all the rest.
Dr. Gounder, as you mentioned, we're sort of in that moment right now where a lot of people have stopped wearing masks. You know, people are heading back to work. Schools were no longer required to wear masks on public transportation, on airplanes. We're at a moment where people are sort of, it's been left up to them to figure out how to best protect themselves. So what do you tell your patients they should be doing to keep themselves safe?
I think the challenge here is that people need to be armed with information. And if they don't have good, accurate, actionable information, it's very hard to take measures, steps to protect yourself. And so one is looking at the CDC website. The challenge with the CDC website is when you look at what it labels as community COVID risk, that really represents how likely are you to end up in the hospital and get crisis standards of care or normal standards of care if you get COVID. You should really be looking at what the CDC labels as community transmission levels to assess how likely you are to get COVID if you go out in the community without masking or in crowded indoor spaces.
And so, Dr. Gounder, I want to ask you about vaccines as we move into this sort of era of these new subvariants, right? It's a little unclear to a lot of people how efficient the current vaccines are when it comes to these highly contagious subvariants. Are you recommending that all of your patients over 50 get that second booster? What are you recommending in terms of how vaccinated we should be and continue to be at this point?
I think it's really important for people to understand that if you are vaccinated, if you're up to date with your vaccinations, you are very well protected against hospitalization and death. But the vaccines will not prevent all infections. So if you really want that extra layer of protection, then you may want to consider wearing a mask, socializing indoors, and things like that. What am I recommending to my patients? Well, first of all, everybody 50 and over in this country is eligible for a fourth dose of either Pfizer or Moderna vaccines. I am certainly strongly recommending that my patients 65 and older or patients 50 and older with chronic medical conditions, or for that matter, really anybody who has immunocompromising conditions, that they really get those full set of 4 doses of either Pfizer or Moderna.
Dr. Celine Gounder, thank you.